Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Talks about how older adults find ways to slow the aging process. And I guess we've talked about uh, trying to keep your brain young. And this is probably the simplest way of all. This is actually a two-page article. Says that the one of the best ways to slow down the aging process is to try to help others and just say yes to the opportunity to make people better. And this is something that in many ways we are familiar with, but it's it details many examples of how uh, people decrease their brain age just by volunteering to help others. So their role model for uh, keeping your brain young is to just say yes to people who need help. And that's pretty simple. And I thought it's an interesting two-page article, but the bottom line is that by helping others, you help yourself and you uh, keep your brain young. And there are many other ways as we've talked about from time to time. What are some of your thoughts about the simple way of keeping your brain young by helping other people? Any thoughts about that? Pretty simple, huh?
I've been helping out my dad for the last 2 years, since his wife died. He's 102, as you know, and living independently. And we worry about him, but he's in a one-story house, and he gets around pretty good with a walker. But he's so stubborn; it's so hard to help him. I mean, he loves it when I cook for him and leave things in the freezer for the next month, and he's all set for a while. But he's very stubborn. He won't. I try to say a little PT might help, and he doesn't want that, and he doesn't, And I think after 2 weeks he's happy for me to go because he doesn't he doesn't like the observations. But it's
Yeah.
he's always happy when I come, so I don't know if that counts. But the drive is a little tough to upstate New York.
Any other comments? Uh,
Good morning, everybody. This is Sylvia. I think now, since all this chaos is going on here, people are more inclined to help prior to let me say, the ice chaos. And so it's a good thing that people now are watching out for others
Mhm.
compared to before, I'll say before COVID and ice. So just an observation on my part, people are, when they see ice in the neighborhood, people blowing whistles and sending out notices through the Ring doorbells and things like that, letting them know that, watch out, just, be safe.
That's very interesting, Sylvia, and it's very true. It's nice to see communities bonding like that.
okay. That's the first observation. The second article is a study that shows how that stress prematurely ends Black lives. That's not a surprise to any of us. But and I guess we've known of studies that have demonstrated that for at least the last 20 years. And as a matter of fact, we had a project called the Be Blessed model that showed some of the same things, that chronic stress takes a biological toll that shortens lives, and two blood tests that demonstrate it are the C-reactive protein, and interleukin-6, all of these demonstrate inflammation. So the stress that we endure because of the social elements that have said that if you're black, you must step back and you're inferior and all those kinds of things. Microaggression, macroaggression, and all other things. They have biomarkers that demonstrate something that we know for quite a while that being black has its own way of shortening your lives. And all of the studies have demonstrated that our lifespan is shorter, and the problem is stress. And so, doing those things that minimize stress are things that will allow you also to live longer. And that's not a surprise, just sharing something that we've all known, but we're getting more and more tests, objective tests that demonstrate that when you're black and you're dealing with the issues of how others regard you, does uh, we do pay a price for it. Any comments on that uh, simple article?
Yeah, I recommend the news diet, and that's only checking the news once a week. That'll reduce stress. And if you only check it once a week with the news cycle where they keep repeating everything, you won't miss anything once you do your weekly check.
Yeah, well, if you're in DC, make that day Monday. That's when the health report is out. But I agree with him completely. Boy, the news is really positive, really positive. Um, the third article that's kind of short, but it talks about how TV doesn't depict CPR like it should. And uh, let me ask all of you, except of course the healthcare providers, uh, what's the first thing you do if you think somebody's got a cardiac arrest?
Call 911.
Okay, what do you do? Oh, good, good. What do you do after that?
We
Well,
clear their
you
airway, right? Make sure the airway is clear.
you have to make sure that they are safe. That the physical surroundings won't impact them, like something falling on them, or they further injure themselves after that.
Any other thoughts? Because many would say that's not the first thing you do,
What about taking a pulse?
and they say that's not the first thing you should do. Mm.
Do you make them
I
lay
said,
down, lie down?
well, you're hitting the nail on the head in many ways, because it's important to get them on a flat surface.
Yeah.
Because if you do it in bed or in some soft, you can't compress
Mhm.
adequately. In 2008, they stopped doing the mouth-to-mouth resuscitation, so that the first thing to do is get them on a hard surface, and then do chest compressions. And on TV, they show a lot of people trying to find a heart rate and pulse, and giving them mouth to mouth, and that no longer is what is recommended for CPR. It's recommended the first thing you do, get a flat surface and be able to do the compressions and do the compressions in a timely fashion. Uh, and they say that less than 30% of the episodes on the TV demonstrate the right way to do CPR. And most of the CPR is not done in the hospital. Most CPRs are done at home, because that's when people fall out or wherever they fall out. And they emphasize that And as you said, calling 911, of course, is correct. And when you call 911, they will tell you to put the person on a flat surface and start compressions and doing it in a rhythmic fashion. Uh, and uh, uh, and I think that it's interesting because not too many people take CPR courses, but it's very valuable. Many churches will have CPR courses, and they will tell you some of these things. Any comments on CPR? And any of you had the opportunity to administer CPR?
I practice. I have training every couple of years as a diver
Good,
professional.
good,
I have to
good.
do that. And they say when you're doing the chest compressions, you think about the Bee Gees, staying alive. Mm, mm.
Yeah.
That's
Yeah.
the perfect tempo
Right.
for chest compressions.
Yeah. Any
Yes,
other comments?
I also had CPR training. I didn't, it was supposed to be renewed this year, but I didn't renew it this year. But I did take my grandson to it. So I listened to the presentation and I might as well have paid and gotten my certification, but I didn't. But that the song that was one of the things they said, and of course putting them on the on a flat surface and calling 911. So yeah, that was just back in November when I listened to the at my church. Yeah.
Any other comments?
Yeah, I remember back in the day as a teacher, we all the teachers had CPR training like once a year. I think it's been a long time. It's been probably 30 years ago, but teachers had it too.
Yeah, I think it's very important. Dr. Perez?
I actually wanted to hear Mark Tatum's comment on Black stress, and how we might, move forward. I'm sure the in Minnesota.
Hello, good morning, everybody.
Might see some aspects.
Oh. Seems like your audio was going in and out. Okay. But I think she was responding because I had my hand raised earlier. You're responding to the black stress, and it was more of a wondering. I would want to do more research on generational black stress. I feel like African Americans, yeah, we have a higher rate of hypertension and heart disease and all those sorts of things. Um, I like I get the feeling that we're built differently. Um, we've definitely sustained generational stress, generational trauma from our ancestors and slavery and things like that. And so if that's put us at a higher chance for elevated levels, are we? I think we're built for more. But then if we're compared to our other uh, counterparts, they weren't built for that, so they see us as different as. I mean, and I do recognize that we are dying earlier and sooner than we need to, but are they compared to? I'm thinking about comparative data. Like, are they comparing us against a standard that's not our own because they don't have these kinds of conditions that we do? So it was just I was just wondering about all that. So I know they say it's stress, but how much of it is generational and ingrained into our system as a people versus they're comparing it to themselves and they look at us as outliers, that sort of thing. So I was just wondering out loud, sort of thing.
Well, the study the most recent study, because there's been many studies, but the most recent study was comparing 1,500 blacks to whites and looking. One of the things that I think is important is to recognize that all of these studies have their invalid aspects because many of them do not address the generational aspects that you mentioned. Uh, but one of the things that is clear is that all of the studies that I've seen over the last 20, 30 years have identified that the blood tests that identify inflammation are the ones that are increased and maybe the ones that are responsible for the hypertension and the diabetes that we have 3 to 4 times as often as other ethnic groups. Remembering that we are all of the same race, we're all Homo sapiens. It's just that if you're our complexion, wherever you are in the world, they look at you differently. And so it's a topic of great concern. Your point is very well taken. Thanks for sharing. I see Darryl and Lucille. Dr. Perez's hands up. Darryl?
Yeah, there's a theory that African Americans have a salt retention gene that was selected during the Middle Passage for the transatlantic slave trade. And so far, that's not supported by any scientific or historical evidence. So it's probably more epigenetic factors that factor in, like our diet, societal stress, um, that many African Americans are located in food deserts where nutritional food isn't available. We eat, we eat too many ultra processed foods with high sodium content. Those type of things may contribute to a lot of the chronic diseases that we experience as an ethnic group.
Thank you for sharing, Dr. Perez.
A study done now over 20 years ago called Unequal Treatment, Confronting Racial and Ethnic Healthcare Disparities, which looked at over 100 studies based basically on Black and white as quote unquote different races. And one of the things that I think is very, very important that came out of that study, which was done by Congress, and little Jesse Jackson was the one that spearheaded that study by the Institute of Medicine. It showed, and I think it's very important that we not blame the victim for the situation. Blame the victim for food deserts. Blame the victim for so many things that contribute to chronic diseases because it's set up politically and economically to have the impact that it's having. And slavery is a significant component. And I think there is enough to address the slave health deficit that people of the African diaspora are impacted by. It does not mean that with knowledge we shouldn't change behavior, but I think it's very, very important that we do not blame the victim for the consequences.
Mark, did you have your hand up again?
No, that was just me
Oh,
giving
okay.
a clap for the comment.
Oh, okay. Okay, any other
I
comments?
appreciate the clap because it is so important. And the other component that I wanted to say was if we did longitudinal studies on the type of attacks that are happening now in Minneapolis, which is similar to the kinds of attack that our people experience from the Klan, I'm sure we're going to see the epigenetic changes in the people there. Just a comment.
Well, epigenetic changes take time, so it will take a while to reflect itself. But anyway, thank you. Any other comments before we go to the articles. Oh, there was the last comment was about a man with dementia who's been married for 39 years, and his dementia is so progressive to the point that he proposed to his wife again to get married again 39 years later. So they had a wonderful wedding ceremony again. Of course, they were already been married for 39 years, but his dementia didn't remember that. So it was nice to see that he actually proposed to her again, and they actually had another wedding ceremony, which I thought was very touching. Yeah. Okay. If there's aren't any other comments about any of those matters, then let's go to the articles.
Darryl has his hand up, Doc, and so does
I
Bill.
think it's
Okay,
I think
Darryl.
that's really sweet that he still wanted to get married again after 39 years.
Yeah, it's very touching. It's very touching. And she doesn't have dementia, but she went along with it and had the wedding ceremony with him, even though uh, he didn't remember they were married, but uh, she went along with it. They had a nice ceremony. So it's amazing.
I,
Some good things happen even in spite of dementia.
I don't
Oh,
have dementia and neither does my husband, but I think it's time for him to propose again after all the stuff I do for him. He said
Okay.
he just did, so I won.
Amen. Oh, that's wonderful. Wonderful.
Okay, thank you for sharing. Okay, all right.
Will the service be Valentine's Day? Next Saturday.
Uh,
I'll make him give me a date by next week.
this is an article about the flu, how to manage the flu that my daughter and I put together for the church, and so many people are coming down with the flu. It's in our medical meetings. I'd say about a third of the doctors have come down with the flu. Some are wondering, I got the flu, even though I got the flu shot. Well, the flu shot actually is to keep you from being hospitalized and from dying. And so if you recovered from the flu, that's wonderful. Although most of the most recent studies demonstrate that the vaccination will give you a likelihood of about 40 to 50% protection. But anyway, this is an article. He just talks about what the flu is about and the variants that causing 90% of the flu cases uh, and that the symptoms are pretty much the same as always in fever, cough, sore throat, runny nose, aches and body aches and fatigue. The problem is that if you're in the group of people over 40, 50 and 60, if you don't have the ability to fight it off, it can cause you to require hospitalization and even kill you. There's so many deaths that have happened because of the flu in older patients. And so the idea of masking again and washing your hands frequently are still things that you should do. Now, one of the things that is great is that we do have medications that treat the flu. And but the important thing is that you need to take it within 24 to 48 hours of getting the flu. The sooner you take it, the better. And these pills, taken twice a day for 5 days, usually are very effective if you started within 48 hours of getting the flu. And these medications are very effective, particularly if you're in the group over 65. And then, of course, it's important to remember if you're over 65 again to get the the double dose of the flu vaccine, which is especially good for those people whose immune systems have decreased because of their age. And then we emphasize getting the medication within that window of 48 hours. And if you're really smart, you get the COVID flu test. They have a test now that has the COVID as well as flu. And if you find out you're positive, you can call your doctor and get him to call you a prescription for the anti-flu medication, which are very helpful. Any comments about the flu and how you should protect yourself, and if you get sick, what you should do promptly so you can recover? Dr. Perez?
I appreciate your last statement, Dr. Callender, because with many friends and family members who have become sick, trying to get to see your primary care provider within 6 weeks is difficult at best.
Right.
So, you know, being able not only to advocate for yourself, but to begin to do those preliminary steps is critical. And we have to fight the fact that Medicare does not pay for visits, virtual visits anymore, requiring that you see someone. So then we're pushing people to urgent care that doesn't always have the continuity that we expect from our primary care providers. So that's a very, very important point that you raised for our group. Thank you.
Any other comments? Thank you for sharing, Dr. Perez.
Not paying for virtual?
Didn't hear the comment.
Yes, virtual appointments by Medicare under the Secretary of Health and Human Services has been suspended. At least that's what I was told in Maryland. And we used to, during COVID, have the opportunity to have those visits interstate. That also has been changed. So it's very important to find out those things from your individual providers and how to, I was going to say how to handle such kinds of emergencies, because the worst place to go sometimes is the emergency room. I had a fall and I said, okay, I had a fall, but I don't want to come back with, you know, an incurable contagious illness from sitting in the emergency room for 26 hours.
Yeah. Well, I think the idea of having the COVID and the flu test to take yourself to find out the diagnosis could be very helpful. Anthony?
Good morning, everyone. I find that here in California, the same problem about quick access to providers is as difficult as it is anywhere. So for people like me, who as a transplant recipient, I'm immunosuppressed, my physicians give me prophylactic prescriptions for the conditions that I frequently get, like pneumonia, vaccines, or in this case, Tamiflu, so that I don't have to wait to see that physician. If I contract, test positive, I have the prescription already. prepared, because otherwise, whatever the emergency rooms here, yeah, I was listening to Dr. Perez. It could take days to actually get to see someone just to get a prescription. So, and here, telehealth is still being paid for by Medicare, but I think the state of California is contributing the shortfall from the federal government suspension.
Thank you for sharing, Anthony. Okay. All right, let's go to any if you no other comments, we'll go to the next article. Oh, I'm surprised nobody asked the question. I thought John would ask the question about how much do the COVID and the flu vaccine cost. I mean, flu test cost, but I don't know. Does anybody want to answer that question? No, John didn't ask it, but
Out here is $23,
oh, okay. All right.
and on Amazon as well.
Okay. Thank you. Thank you for sharing. This is an article that is kind of tough to realize that we have to go through this. That and you see a laundry list of 12 medical professional organizations that have gone against CDC's recommendation. And when you have a situation where 12 medical organizations are against what the CDC is doing, that says a lot that we've got a big problem. The question is the CDC listening? That's the question. But when you got this laundry list of groups, very important, powerful medical groups that do not agree with what the CDC is recommending, I think this is not a good sign for the practice of medicine and the people trusting in our CDC, which is the body that in the past has given us great advice. John Buchanan?
Yes, I'm relating this to something I noticed as a teacher, shaking the haters off, because those folks who don't want to listen to science are probably kind of dumb. They probably failed their science classes and they hate smart. I mean, I'm serious. They do not like smart people because they feel inferior to smart people. So they're haters. So those folks that want to put down Anthony Fauci and all the brilliant folks that have been helping us cure these diseases, including Ebola, which if not researched and solved, millions more millions would have died just from Ebola. So I really think shake the haters off, as Barack used to say, shake them off.
Darryl?
Well, another viewpoint from AI is that authoritarian regimes often work to discredit medical organizations and professionals to eliminate potential centers of power, suppress evidence that contradicts state narratives, and ensure total control over information and public obedience. By framing public health institutions as political adversaries, these regimes can solidify their power and minimize opposition. So it's all about minimizing opposition.
Well, they have failed to do that because clinicians have are speaking out. But you've voiced exactly what they're trying to accomplish, and this is just the tip of the iceberg. Any other comments about the getting together with the medical organizations in addition to suing the health secretary for what he's done with the CDC?
And I think our inability to be part of the global conversation that David Satcher so eloquently pointed out, that many other nations and health entities don't trust, nor are they communicating that information with us. I mean, we're not part of the conversation globally. And if you talk about Ebola, I mean, not only because of the genius that exists in this nation, but just our ability to be warned of incoming dangers.
Yeah, it's frightening, especially when you think of a new virus that was just identified that for which there's no treatment. And if we're not part of World Health Organization, how are we going to be globally prepared since we are doing just the opposite of what everybody else is doing? So it's a concern that the fact that we are going in a direction that is counter to what common sense would lead us to. Any other comments? Janice?
I think what's concerning with the Secretary of HHS and the decisions that he and CDC and the rest of them make, it puts the physicians in a bad position. I'm sure they're given directives that possibly you and other physicians really don't agree with. How do you handle that?
Well, they're handling it by suing the secretary
Yeah.
and by joining together and expressing their comments. But with this administration, what will that accomplish? And that's time will tell on that one. It's kind of scary.
It is. Mm. Okay.
Any other comments? If not, we'll move on to the others because this is a study that identifies, as we talked about, the C-reactive protein test and the IL-6 evidences of inflammation, the same inflammation that cause arteriosclerosis and all of the things that that our disease produces, which Darryl talked about, a lot of which are related to our diets. But the inflammatory biomarkers that they mentioned, C-reactive protein and the C-reactive protein is just another example of the inflammatory markers that cause heart disease, cause diabetes, cause many of the reasons why people are dying earlier. And this inflammatory process is heightened by the processed foods that we love so much. So in many ways, we're eating ourselves to death. In many ways, not only the diet, it's also smoking, poor sleep, it's stress, it's many things. It's the air we breathe, the plastics that we consume without realizing it. And it's a laundry list of many things that are part and parcel of and the cholesterol, the lipo A and the C-reactive protein are examples of the increased inflammatory state that results in many of these diseases. We've talked about many of them before, but the question is, what are we doing about it? And I guess the one thing we can do is to eat less processed foods, and be sure that that we know what our cholesterol levels are, what our GFRs are, what we know what our hemoglobin A1C is, and I think one of the things that has become evident to me is that many people uh, they get the blood tests, but they don't know what they mean, and they don't follow them up to uh, change their lifestyle. They don't want to do the exercise, they don't want to do the meditation, and they don't want to increase the vegetables and fruits and eat less red meat. But these are the things that are part and parcel of decreasing the inflammation that leads to the chronic diseases that are killing us. Any comments on these articles, which we've talked about the cholesterol, AP, APOB, we talked about, and others. John Buchanan.
Yeah, I just had my annual physical for scuba diving, and I think my doctor did some tests I'd never even heard of before. So, I'm with Kaiser. So they break it down. Each of those tests they show you the trends over the past 10 years or so, or even longer. And if you click on them, they'll tell you what each test is about. And I've learned a lot just from I mean, if we just look at those numbers, that it's you can't really tell anything. You have to see the trend. You have to see, what's acceptable, the ranges that are acceptable and healthy, and uh, they'll let what's going on. One, my doctor said the only thing I need is more vitamin D. I couldn't believe that, but that might be because I haven't been drinking as much milk as before. Thanks.
Thanks for sharing. I think I've been impressed with the ignorance of patients in terms of understanding what the blood results mean. And if you don't particularly ask your doctor about it, it's just a number. And I think it's so important to do what you just did and talk with your doctor and understand the significance of what the numbers mean. Dr. Perez?
That without your doctor going through it or having the opportunity to do it online, you wouldn't have had that information, which speaks to the fact that our insurance should pay for a review of your lab results and their impact. When a pediatrician has 7 minutes 7 minutes to say hello and come up with a diagnosis to be paid for a visit. That's ridiculous. This is the patient-physician relationship that is critical. Am I wrong, John? I mean, didn't that make the difference? And didn't that change your behavior? Am I
Well,
right or wrong?
you're right. But the problem is that most patients that I've interacted with, uh, they have the blood results, but they do not know what it means. Just as John knew exactly what it meant, and he got his doctor explain it to him. But many people just they see the blood results, but they don't understand the significance of it and how it should affect the way that they eat, drink, sleep, and all of the things that they should be doing or not doing are not really explained to them. Information is power. And uh, in order to be educated and empowered, you need to take time. And so if you have a situation where your visit is 10 minutes, then the ability to explain and understand what each lab test means is unlikely to be shared with the patient. As John is blessed in the sense that he has that, but I don't know how many other patients have that experience. How many of you know what your GFR is, know what your cholesterol level is, know what your blood sugar, hemoglobin A1C is, all of the tests that you get? Do you really know what they mean, or you just uh, do you know the trend, as John Buchanan mentioned, what the trend means, or because the lab test of itself, without knowing the trend, may not be as important as the trending is. So these are just Anthony.
Well, I think it depends on the individual's circumstances. So a person like me who has multiple co-occurring physical illnesses, I have to know what every one of those numbers and tests mean. Just because for me, with a transplanted organ, ignoring something significant could cost me my life. So I think it's again about whether life has introduced you to circumstances that force you to learn what these things mean. And most of the people that I know who are chronically ill understand what their labs mean, but that's only because they're dealing with chronic illness.
Your point is well taken. One of the ways to get old is to have a chronic disease and 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 get to live long. Whereas if you're healthy, you don't appreciate the importance of every single one of those blood tests. So I think your point is extremely well taken. Betty, Leila?
Yes, I agree with you 100% because my husband is a diabetic and he knows all of his whatever he needs to know. But there again, you remember one time I said I was taking no medication, but I am on some medication, but quite frankly, I don't really know what it's for. And that's because so far I've been pretty healthy and I don't have any complications other than this drop foot that I got doing a surgery, but it's not, you know, I don't. So the what Anthony just said about people who have a condition, they make sure they keep up with it. But with me, I, and I'm being very honest, I really just don't pay that much attention because I'm feeling fine.
And that's
Could be
generally the case.
dying, but I'm feeling fine.
Any other comments? Anybody else want to share? Okay, and I think it's important for us to be aware of what our lab results are, what they mean. I just talked to a friend of mine who had a elevated cholesterol, but he didn't like taking medicines. But high cholesterol will kill you. So you've got to really understand that and be able to know when you need to take medication. Buchanan?
Yes, I noticed one thing about Kaiser. In the past, I would have my physical and then have my lab work. So I've learned that if my lab work is completed before I have my physical, then my doctor can prescribe whatever changes might be needed. So I recommend that for everybody. If you have the opportunity to get your labs done prior to having a physical, prior to seeing your physician, that'll really help because it's like being proactive. I recommend that highly. Thanks.
Thank you for sharing. Okay. All right. Dr. Perez?
And all of these tips are so important for us to share with our family. If you have a family member who you know has diabetes, asking them what their hemoglobin A1C is, or asking them what their cholesterol is, or hypertension, we've got to advocate for our people. And we need to, it's a way of showing love.
Well, I think the importance of this group that we have is to emphasize and uh, make people aware. I really think that the more people we can reach to help empower and educate them relative to their own health, the better off they are and the better off we are. And so the more people we can get exposed to understanding their own health and how to achieve the healthy state and sustain it, the better off we are. And that's a job that we need to do even better than we're doing right now.
That's me right here. That's done here.
Any other comments? Janice?
One more thing.
What's going on, Dr. Callender?
Hi, welcome.
How you
How are
doing,
you?
man?
Good to see you.
Good to see you as well. I'm trying to get you. There we go.
He's looking for you. He's scrolling.
Oh, there you are. What's going on, man? How are you?
I'm good. I'm good.
Good to see you, man. You look exactly the same.
How's school?
Good. I'm not in school right now. I'm with a job right now, but it's going very well.
Good.
I'm finding my way, so it's going well.
Good. Good to see you.
Absolutely, man. I'll catch up with you next time. All right.
Okay.
Absolutely.
Okay, be good.
How's your sister?
She's doing well, man. Hopefully she'll be in town for Super Bowl weekend. So if she swings by, I definitely tell her you thought about it for
Okay.
sure.
All right.
Yes, sir. Take care, man.
Okay, good to see you. Okay.
I guess you can tell my kids think of Dr. Callender as Uncle Clive and this, okay, man, yeah. I mean, it's all in love, right, Dr. Callender?
Yes, I do.
Yeah, but it's been a while. He says, Dr. Callender there? I said, yeah, I want to say hi. I said, okay. But they're both doing well.
That's wonderful. That's great.
Good.
You've been blessed. You've been blessed.
I have been. I really have been.
Dr. Perez, you had a comment?
I want this group to know that I am healthier because I'm on Thursday. I'm a physician and I am healthier because I'm on Thursday. And I believe that the people around me, because of the tips and the transparency of all the members on this line, those who are associated with me are healthier. And we just saw an example of multi-generational improvement in health. A young man who thinks of Dr. Callender as Uncle Clive and will stop. You know how private these young people are to stop and get on a line, on a Zoom call. Hallelujah. Hallelujah.
Thank you, Dr. Perez. Janice, did you have any comment?
Yeah, I just wanted to follow up on that, Dr. Perez. We, of course, didn't always do virtual. And during the summer months or when school was out, David would take them to group on Thursdays. They loved it. I thought they would see it as punishment. Oh, they learned so much. They met new friends. I think Carol might remember them coming there. And they felt very comfortable and coming to the group sessions. So comfortable that, where's Carol? With Tatum and his passing, and I passed it on to my son. He said, Ma, I know, I talked to him several weeks ago. I said, you did? He said, yeah, that's the transplant family, right? I said, yeah. They stay in touch. They remember. I'm like Dr. Perez, I learned so much from these sessions. And when I leave, okay, what did they say this time? What's the main topic? I pass it on. I do pass it on. But one thing I wanted to say about the last article, we talked about the knowing your numbers, and it's very important. Now, I can't recite mine, but I'm like Buchanan. I get my blood work first, then I go to the doctor. And I go from top to bottom, and he explains everything. And the good thing about him is there's no time limit. We take our time, we talk. He's aging, and he's Asian, but I love him to death. And he is really a wonderful primary care doctor. But it's important to know your numbers. And whenever I have a question, if you have a good doctor, he's going to take the time to explain it. So keep that in mind. Find a physician that you can trust, and you'll be okay. Health is important. Knowing your doctor and knowing Dr. Callender in the transplant group.
Good morning, everyone. I've also learned now that they got this newfangled technology, when you go and get your blood taken and they put it on your portal, and then once you figure out how to get on there, and you don't have to remember your passcode, all you have to do is remember something, and then they'll let you in.
Mm-hmm.
But if I don't know what that number means, that's why you got Google on your phone or Siri, whatever you got. I go and look that up to say exactly what is normal, what does it mean? And then so when by the time I get to my doctor's office, he'll dispel all of the things that I really made a mistake on, knowing whether or not I'm getting ready to croak or something. But, you know, I look at the numbers, I look it up to see if I'm normal, or if it's too high or too low or something like that. But it usually tells you on those reports. Then you ask the doctor, how does that really affect me? And I love Google.
Mm-hmm. Mm-hmm.
Thank you for sharing, Carol. Mark?
So it was good to be here. I'm getting ready to head out for today, but it was, I hadn't joined you guys in quite some time. I had a 2-hour delay for the start of my day, but I got to get going now. But Mom, you want to tell them?
No, you tell them.
What happened on this day 49 years ago?
Oh, that's right. Someone came 20 days early within 2 hours, and I wasn't ready because I had a 6th grade class. Today is none other than my second child, Mark Tatum's birthday.
Congratulations.
Happy birthday, Mark.
Happy birthday, Mark.
Happy birthday to you.
Happy birthday, Mark.
Thank you. So I was privileged and blessed to be able to start my day, spending time with you guys. Hopefully I'll have some more Thursdays where I get off and I can spend some more time, but just wanted to say thanks for letting me swing by again, and hopefully see you guys soon.
Well,
Happy birthday.
Been
Carol,
such a
I can't
birthday,
believe
Mark.
you forgot.
Done. To donate to your father like you did.
Happy birthday.
Happy birthday.
Happy birthday.
Thanks for joining us. Pearl, your hands up.
Well, I just wanted to comment on the last subject we were talking about knowing your numbers and what they mean and things like that. Because I too have Kaiser, and they put a chart on their website. They post everything on your website. But when I asked my doctor about certain things, she informed me that as long as your numbers are within whatever range, because they have it separated into different ranges, high, medium, low, or whatever. But anyway, my doctor told me as long as you are within the proper range for your age, then you really shouldn't be that concerned. Well, she said there was really nothing for me to be concerned about as long as I fell within, the range for my age group. So I don't know whether that has anything to do with anything, but
Well, that's great. I would agree with that. Uh, if you look at your numbers and you're within the range, then you're right. Then that isn't a cause for concern. But if you are outside that range, then it becomes critical. But thanks for sharing. Um, this is an article that is for people who have IgA nephropathy that they have a medication now that preserves kidney function. This is wonderful if you have IgA nephropathy. That is not a very common cause of kidney disease, but as a matter of fact, in the past, when you had the IgA nephropathy and it was not controllable, they sometimes required kidney transplants. But this medication has remarkably been able to eliminate that. So this is a new medication. So probably no one on this call has IgA nephropathy, and it doesn't mean that much to them. But the fact that we can get one medication that does that for one nephropathy means that down the road we will probably be able to do it for other kidney problems. So I just wanted to share that as a sign that we're making progress. And research is so important that it's important that we share these things and not try to pretend that they don't exist and pretend that research is not the way in which that we stay healthy. And inhibiting research is the antithesis of how we make progress. So let's go to the next article. It's interesting. This is another article that shows that there are some things for which cannabis is helpful. And for fibromyalgia, which I'm not sure if any of you know that that's a condition that people have a lot of pain and fatigue and others uh, symptoms that really are not treatable by conventional means. And actually, cannabis is now at certain doses is capable of improving these and eliminate some of the signs and symptoms of fibromyalgia, for which there really was no good treatment before. And so to have fibromyalgia to be able to be treated by cannabis successfully is a step forward. I know I spent a number of hours treating patients with fibromyalgia unsuccessfully, and to have cannabis to be effective, because for many of these patients, there was no treatment that was effective at all. And so uh, cannabis appears to be one of the drugs that now is able to overcome the fatigue and the joint pain and the inability to sleep that is commonly associated with fibromyalgia. Anybody in this talk have any family with fibromyalgia? If you did, you'd understand that this would be very meaningful. But it's a condition that if you have it, it's extremely hard to treat. Darryl?
Are edibles a preferred method of delivery?
Oh, they didn't mention the preferred method of delivery of the cannabis in the article. I'm glad you mentioned that. I just have to look that up.
I have a cousin lives down the street has that, and they had discovered that too, but I don't know how they take it. Because you can, there's edibles and pills and smoking, I guess, are different ways of taking it.
Well, yeah, they have different ways of taking cannabis, uh, and then the article didn't identify exactly, but it is a condition for which we are incredibly ineffective at treating it, diagnosing it and treating it. And so, if cannabis can help with it, then I think that's great. Because I've never met a group of patients who were so unhappy and so distressed as patients who had fibromyalgia.
Did you actually tell them that you couldn't find a way to help them?
No, I kept trying to use medications, trying to help them, but none of them were really very successful. I didn't tell them anything. And I just made the observation that they were very difficult to treat, and that in spite of what I did, they still were very unhappy. No. But it's interesting that you asked that question. Just that's one of the articles: is how do you tell people that the outcome is not good? But we'll cover that article as well. But it's interesting that you would ask that question. Now, this is something that we've known for some time, especially in the transplant arena, that many recreational drugs are linked to poor outcomes after heart attack, as well as causing heart attacks, and as well as causing kidney disease and other things. So that recreational medications are associated with a lot of problems with hypertension, heart attacks, and the fact that if you are on a recreational drug, that the likelihood of you having a good result after a heart attack is decreased. I know in the transplant arena, we had a number of patients who actually had the kidney failure from the recreational drug dose, and then they had heart diseases from the recreational drug uses. Uh, so these recreational drug uses are uh, not good for you. Dr. Perez?
I would say 100% of the patients that I have taken care of who were on quote unquote recreational drugs needed access to mental health services. And to see this, they were self-medicating because they could not get to good mental health treatment, therapy, and intervention. And as we saw in a previous article, depression associated with a bad cardiovascular disease outcome really speaks to the importance of making sure that we have access to good, comprehensive mental health treatment.
Hard to come by, but it's so very important. Okay, let's go to the next article if no other comment. We are plagued with obesity, and it looks like it's going to get worse because although we take all of these anti-obesity drugs, we still have the prevalence of obesity, and it's not good. But what they're saying is going to be worse. It's hard to recognize that we're going so rapidly in the wrong direction for a disease which is wreaking havoc on all of us. Any comments about uh, what to say about obesity, except that we need to, it's a chronic inflammatory state that is not healthy. So, John Buchanan?
Yes, I believe part of the issue is the acceptance of society for fat people.
Yeah.
I mean, all not all of them, but a bunch of the rappers, big fats, and, you know, uh, and it starts as children. I see a lot of fat children as
Yes.
well. So it's not a stigma. It used to be a stigma if you were fat and you were ostracized, but the last 20, 30 years, it's been a sign of prosperity, I think, even. Thanks.
Nowadays, all the commercials have people who are obese on them, which you never had before. So they're making it to be comfortable with being obese. Betty and then Carol.
Yes, I know all of you all remember that I started my diet when Dr. Callender, one of the articles said not eat after 4 o'clock. Uh, so I just want you to know I was probably considered obese when I started. I don't remember what weight I was actually when I started, but I weigh on the 1st and the 15th of each month. And the 1st of this month, I weighed 137. So I know I was
Wonderful.
well over 150, 60 when I started. So
Wonderful. Congratulations.
I'm sticking
Congratulations.
to it.
Good, good, good. Carol?
Haven't there been articles that said some of the obesity, it has to do with our eating habits, then some of them have to do with our mental health problems. And they are finding it so much, just like they used to say, drug addicts, just quit if you wanted to, and etc. And then some of them were thyroid problems. So whether it's alarming, is America having more mental, physical health problems, or what is calling the obesity, or it's just our poor McDonald's every other corner in poor neighborhoods? What is the culprit of all of this?
Well, it's interesting that there are many causes, as you mentioned, of obesity, but it seems that the major cause is related to the drive to eat, and the mental aspects of it are as important as other things. It's not very common to find out that the disease is causing the obesity, but more likely it is related to the mental state and anxiety and depression. But I think everybody who is obese and goes for care, they mental health is an important part of the process of addressing obesity. Darryl?
If you look at this country compared to just about every other country on earth, in other countries, they walk to get their groceries most of the time daily at little small groceries rather than the big supermarkets. Um, they don't drive very often. We drive everywhere. We got fast food restaurants everywhere. Um, so just look at our diet, our lifestyle, and our diet, and it's easy to see why we're the fattest country on earth.
Thanks for sharing. Any other comments?
I want to say one thing. Fat shaming also contributed to obesity.
How so? Tell us how so.
That people refuse a mental health issue, that people felt isolated. And I know I was often told, just lose weight. as if I wanted to be fat,
Yeah.
and then, hearing, you have such a pretty face. And the
Yeah.
rest of my body, nobody's going to say anything. I mean, and then I, thank God they didn't have cell phones when I was a child.
Thank you for sharing. Thank you for sharing. Anthony?
The shame of this is, as an obese person who's traveled extensively, I can tell you that when you're big, you're treated differently than when you're not in places other than North America. And that's because usually economic circumstances don't lend itself to a society of obese people in those countries. And the people who are obese are usually the people who have all the money. And so the service industries in any of those countries will always cater to the obese person in a travel party as opposed to their thinner counterparts. And I've actually had that happen to me on numerous occasions, especially in Asia. But it's sad is now, if you go to mainland China, you will find Kentucky Fried Chicken, McDonald's, Starbucks, Dunkin' Donuts in every major shopping center in most of these countries now. And their people prefer that food to their traditional dishes. So obesity is becoming a global problem as a result.
Thank you for sharing. Carol, again.
Okay, our parents contributed to it. All the parents that said, we need a clean plate club and you got to eat all your food or somebody in Africa is starving. They contributed to it. And then eat all your food before you drink, which is another thing that we did because our parents did it and everybody else did it. Then they piled the food. You got to eat to stay happy. Once a child says they're full, you're not going to waste all of that food. So some of it is because of our training as children.
Okay. Thanks for sharing, Darryl.
Yeah, the fast food companies, they know their food is addictive. And it's not like peddlers. They, want to put it out there because they know that you will start to prefer their their terrible food compared to the food that you've been eating all your life. But can fat shaming be effective? AI says that fat shaming is prevalent and socially accepted in China, often considered a form of direct, well intentioned advice rather than bullying. Cultural standards equate extreme thinness with beauty and success, leading to open criticism of weight by family, peers, and media. Weight related discrimination is common, significantly impacting mental and physical well being. So that's China for you.
Thank you for sharing. Okay. There aren't any other comments. We'll go to the next article. Pearl. Pearl, you had a comment?
No, I just wanted to say, as far as being overweight or obese, I have been, I guess, considered obese for most of my life. But during the last, I would say, 4 years, all of a sudden, I just started losing weight. And now I have lost over 100 pounds. And I wasn't doing anything different than what I had been doing all of my life. But I just started losing weight. And all
Amazing.
my life I had been trying this diet, that diet, whatever. But anyway, I lost it and I'm glad. And now some people that I knew hadn't seen in a few years didn't even recognize me when they saw me.
Very interesting. Thank you for sharing. Catherine? Catherine, you're on mute.
Good morning, everyone. Thank you, Dr. Callender. I was just going to say, Miss Lipscomb, I wish that was me. That's not happening to me. But anyway, I was going to say when I tried that to tell my daughter she was 6. I tried to tell her to eat her food because people were starving. She asked me, "Well, mommy, why don't you feed them?" I thought I would add that.
Uh,
So that doesn't always work.
Thank you for sharing, Catherine. Joyce,
Yes, I
Vincent?
have a friend who has moved to Dover, Delaware. And before she moved there, she was a very active person. And when she moved there, she was surrounded by a lot of people that she didn't know, and her life had become kind of still, not interacting. And she had gotten into reading a lot of books. And that's how she basically surrounded her life with books. And she had mentioned to me one time, she said, I have to go to the mirror sometime and just talk to myself in the mirror, just to make sure that I can still talk. And
Mm.
we would try to call her on the telephone to um, give her some relief from being so lonely. She decided that she was going to get a dog. Called her one day and she said, I got me a dog. I said, well, that's good. And she's had that dog now for about 5 months. And she has gone from 205, 220 pounds, I think, down to 195, 80 pounds. So out of her loneliness, she was gaining weight. When she got the dog, she didn't lose weight. I mean, she did not change her eating habits, but she truly lost weight trying to keep up with the dog. So I think loneliness has a lot to do also with weight gain and trying to be healthy. Her numbers have gone down since she has had the dog, and they have really become very inseparable. So that was the best thing that she had done.
Thank you for sharing. Thank you for sharing. Any other comments? If not, we'll go to the next article, which is striking impact of hearing aids on dementia risk, which is something that I think Darryl has talked about, but this is an article that looks at close to 3,000 older adults, and they look at the 7-year risk for cognitive impairment and found it was significantly lower. And most of the studies now are demonstrating that while there may or may not be a impact on cognition, there is a definite impact on dementia. And the fact that having a hearing aid is something that is part of the treatment for the prevention of dementia. And this is a study with significant numbers that surprisingly demonstrates that there's a very significant difference in the risk for dementia in those people who have hearing aids and those who don't. And so that's the essence of this article, which is something we've mentioned before, but this is further confirmatory evidence of that association.
Dr. Callender?
Yes.
I just want to add my 2 cents here. Over Christmas, I was at my daughter's house and my son was there also. And my kids really ganged up on me and told me I wasn't hearing right and I was missing things. And why did I say that? And they really picked on me. So much so that I did come home and scheduled a hearing test with an audiologist. And lo and behold, I do have a hearing deficit. And I now have hearing aids, and mostly because I don't want to go the route of dementia. So at 75, I figured it must be time. And there is some family history of hearing loss. So I went and got them, and now I say to my kids, No more picking on mom.
Not for that anyway.
Not for that. Yeah, they'll find something else.
Congratulations.
Thank you.
Congratulations.
I had to swallow my pride for sure, but I was surprised. But it's not awful, but it certainly makes a difference.
Yeah, I think women handle it better than men. Uh, uh, John Buchanan, then Darryl.
Yeah, I actually followed Darryl on this. I asked Darryl for advice about the hearing. I've had hearing loss for many, many years, being on stage with loudspeakers and next to a drummer who ended up playing with Miles Davis. Uh, I had, severe high frequency loss, and but I was afraid to get them. Then I heard they were very expensive, and all of those fears went away once I got them. My Kaiser covered my hearing aid. It was $6,000. My Kaiser covered them, um, and it's a whole nother world that I was missing. When I put them on, it's like turning on a light bulb in a black dark room, and all of a sudden you see everything. Um, it's another world, and I'm just grateful. I'm thankful for it. Thanks, Darryl.
Darryl?
Yeah, I don't know if we mentioned it because I had to. I got these in-ear monitors. I listened to the group session, and I accidentally pulled them out when I was kissing my wife goodbye. She was going to work, so I didn't know what was discussed during the article. But did we discuss that adults over 60 need annual hearing tests? That's recommended. Did we say that?
Yeah.
Oh, we did. Okay.
Yeah,
Well, the hearing tests are free from an audiologist. And if you think you've got a little hearing loss, it's probably a lot worse than you think. And like John Buchanan says, your life will be so much better once you get hearing aids.
Thank you for sharing. I think if you listen to your children, you'll be wise. I listen to my kids. That's why I got mine too. Carol?
Yeah, but you did say something that was, oh, you always say something that's true. Men are much harder to convince that they can't hear. But another
Yeah.
hazard of us musicians, and I have to include myself, is that in the music world, our eardrums are compounded with the music, whether it's, especially if you're in a band. But if you're always in music, you're in music, and the sounds of it are really take a deep bearing upon your hearing drums. And they had a little illustration. I know when I was teaching a music survey or music appreciation, they talked about a remote village in Africa where they can actually almost hear a mouse. That's because they're not inundated with sound all the time. If you listen right now, even your lights are creating sound. Your furnace, you're inundated. You do not have that perfect quietness that your ears really need to rest from the sound. So whenever you can, even in the car sometimes, I just turn off the radio because the sound of the engine and the rest of that is taking an impact upon your ears.
One of the things that I noticed was that in our medical groups, regardless of the age, very few people had hearing aids. And it seems that men in particular, their egos are such that it's hard for them to accept the fact that they've got to wear hearing aids, and until they get to the point where people criticize them, most of the men are going to not get hearing aids. But I think it's as you've seen by listening to these people that hearing aid make a big difference, particularly allowing you to socialize, but also to decrease the likelihood of dementia. Darryl?
I've got, oh, yeah, okay. I've got an app on my smartwatch. It's an Apple Watch, and it's called Loud Environment. and it'll let you know if you're if you're in an environment where the sound level is over 85 dB. 85 dB over a half an hour can cause permanent hearing loss.
Wow.
Yeah. So, and if you check it out, you can get these apps on your phone that measure sound levels in dBs. 85 is not that loud. Usually, if you're in your car, you're going to play your radio if you're listening to music louder than 85. Uh, some of these churches now have, especially for musicians, have brutal sound levels. They've got these floor wedge monitors right next to the pianos and organs where you can hear the soloists and the instruments. And they're typically driving sound levels of about 100 to 110. So, what can you do? If you're not wearing hearing aids, you can wear some what they call transparent earplugs, where you can hear all the frequencies, but they reduce all the frequencies about equally, and that's a real help if you have to be in those loud environments. But once again, the smartwatches and their great old apps to the rescue. So if you got a smartwatch, turn on that app that's has something to do with loud environments.
Carol?
Okay, what I agree with Darryl. The only thing I did when I would go into a church and the service is extremely loud, they had their praise team, they had the drums mic'd. I mean, you go to a jazz club, the drums are not mic'd. They have everything mic'd. And then one time John did this. We went to Drexel University. Our son was in Drexel Gospel Choir, and in a cathedral where you did not need amplification. Well, he got up and turned all the amps off. The choir couldn't tell. The parents applauded because the sound was deafening to us. But our society is against just about everybody that's up here. If it used to be, if you wore glasses, you were called four-eyed, and that was a sign of indication of getting old. If you walked with a cane or a crutch, they made fun of you. They called it the wheelchair brigade, and etc. Now, hearing aids, there's also any sign of getting older. Our society is against it. It's only for being young. Make your skin look young. Lord knows if you show your age, everybody, oh, you look so young today, and that's a compliment. What's wrong with looking old? Our society is against oldness. Old people, glasses, hearing aids, false teeth, everything. Period. They make you feel bad for getting old. And then some Asian countries, they celebrate, oh, you're older, and they honor their old people. Here in America, the worst thing to be is to be old and any signs of getting older. They just crucify you. That's the end of my sermon for today. Thank you.
Well, thank you for sharing. I guess that's the last comment. Any closing comments? Carol, anything you want to share for us today before we leave till next week?
No, it's progressing quite along, and I want to thank everybody. I'm busy sending out thank you notes, but I just love the group, and I'm glad to see my childhood friend on there, Catherine. We went to high school and college together, and she's in Indianapolis. Now we got somebody from California, Midwest, Chicago. I'm gonna have to start calling my other friends so we can be United Nations, at least United States up here. He's from California and get up at 6 o'clock.
Wow.
Surely the rest
Yeah,
of us
Anthony is okay.
Wow.
Thank you for your welcome.
Yeah, well, okay, another great session, and